Hi everyone, I'm Dr. Z. I'm a clinical psychologist specializing in transgender care. Welcome to my channel. It's wonderful to be here with all of you as always. If you have not yet subscribed to this YouTube channel, please support me and do so. It's really important, especially right now, to support people who create such informative and important content. And if you haven't yet joined me on Instagram, please also do so. That's where I show up daily and offer you tips, guidance, and advice. Having said that, today I'm going to share with you 4 signs that you might be transgender. Now, before we start, let's be very clear that gender is more complex than just clicking off 4 particular signs. Gender is multidimensional, especially when gender is tied to experiencing gender dysphoria and transcendency specifically. There are a lot of nuances on the table. And so, for that reason, I want to be very, very clear that while this is a very simplistic way, it is also incredibly beneficial because these 4 signs are 4 signs that I have consistently observed as a pattern over 18 years of my experience working with trans adults. And I'd say more than 85 to 87%, I have seen these 4 signs existing either altogether or in a very least 3 out of 4 in pretty much everybody that I worked with who had gender dysphoria stemming from core identity gender issue and who identified either as trans femme, trans masculine, or non-binary. So these 4 signs are really, really important. But again, I just want to remind you that gender is not as simple as checking those 4 sign boxes. I also know that a lot of you are feeling overwhelmed, sometimes very confused, unsure, or maybe you're sure, but you're fearful. And sometimes watching videos like this, where somebody who's so specialized is giving you these pattern descriptions, can be very helpful in feeling more anchored and more affirmed in your gender identity. So let's get on to the 4 signs. The first sign is this, and that's a very common one, and a lot of you are going to resonate. You are spending tremendous amount of time thinking about your gender. This is going to apply to all psychological types, whether you are anxious, and as a byproduct of being anxious, you're probably going to spend more time ruminating in regards about your gender than anybody else, but it's still going to be present, whether you are depressive type or neurotic type, regardless of your personality structure. You're just spending a lot of time thinking about gender. What is a lot of time thinking about gender? Well, let me give you this contrast. Let me use myself as an example. I am cis and I don't experience gender dysphoria. And do I think about my gender? Yes, I think about my gender role more than anything else. What do I mean by that? I think a lot about what it's like to be a woman in today's world. I think a lot about um, what it's like to exist on a binary spectrum in this world. I think a lot about the expectations, the stereotypes, and the social constructs that go along to um, identifying as a woman. So I think more about those roles, and then I think about how those roles may inhibit my potential growth, how they may be actually obstacles for me, for example, in my career, for example, in other areas of my life, how some things that I have learned have created limiting beliefs. That's just how I think about gender. That's that way of thinking about gender is something that I think a lot of us tend to do because we do live in a world where there's a lot of social pressures and expectations. Now, the difference between me and a lot of you who struggle with gender dysphoria is that I don't wake up and I don't go to sleep thinking about my gender. I don't think throughout the day about my gender identity. I never question my gender identity. I feel incredibly solid, very fixed in my gender identity as a woman. And that's a good example for all of you to think about. People who have gender dysphoria and people who struggle with gender identity issues spend a lot of time, and I would say majority of your daytime, thinking about your gender identity. You're not just thinking about your gender expression or gender role, you're thinking about your core gender, and you're primarily thinking about your discomfort with your gender assigned at birth, your discomfort with your present physicality. You're thinking a lot of a lot about that. And you wake up, you go to sleep sometime thinking about it. The only time you may not be thinking about it is when your mind is very distracted, is when your mind is very preoccupied. Let's say you threw yourself completely into work project, and for the short period of time, you may not even think about it. Or maybe you are an advent runner, and when you run, you had to go somewhere else completely clear and you're not thinking about it. But other than that, the only, not only, but the time you take for yourself to sit down on a couch, for example, and take a breather, you start thinking about your gender. So that's sign number one. You're spending a lot of time, a lot of preoccupation goes into thinking about your gender identity primarily. Who am I? What does it mean? Why do I feel so uncomfortable? Why is there discomfort? Why do I feel dysphoria? Why do I not like my certain physical characteristics? That's a sign number one. Now, the second sign that may be, sort of precursor that you are either trans or struggling with gender dysphoria is that you are secretly in isolation, engaging in some kind of gender bending behavior. You either feminizing, masculinizing. For a lot of trans femme identified, it will be primarily really a lot of feminizing behavior. Because for a lot of who are trans masculine, it's much easier to present without even being in isolation in a masculine presentation, and nobody's going to bat an eye. But for trans femme clients and non-binary femme, this is going to be a big one, especially for trans femme. You're isolating yourself because you're still feeling a lot of shame and guilt, and you're isolating yourself because you don't want anybody to know. You're not sharing this with anybody else. What does isolation usually looks like for you is this. If you're married, if you're in a relationship, you do it at work. If you have a private office where nobody can see you, you stay at work after hours so you can have office all to yourself. You travel for work, whether you are in a relationship or not, and you do it in a hotel room. You wait for your partner, your wife, your husband, whoever you're in a relationship with, to leave the house because you're working from home, and then you go and you engage in this behavior. It happens in isolation. It gives you tremendous amount of relief. It takes dysphoria from, I would say, feeling for some of you 10 drastically to even 5 or 4. It helps a lot with any kind of distress or tension you feel. So this is a second sign that you may be trans or you're struggling with gender dysphoria. You are gender bending and you're doing it privately. You're doing it in isolation. And isolation is a significant point here because here's the thing about isolation. A lot of you isolating because there's a part of you that on a deeper level perhaps feels a knowing sense that this is your gender identity. And that brings up a lot of shame and guilt, or a lot of sense of responsibility, or a lot of sense of tremendous amount of fear of how it's going to affect your life. And so this is why it happens in isolation, because you can't even fathom sharing this with anybody else, including people who are close to you. So that's a sign number 2. Sign number 3 is a very, very common one, especially for any of you who've been struggling with gender dysphoria for decades. The longer you've been struggling with gender dysphoria and being in touch with the fact that you have gender dysphoria, the more you're going to feel the sign number 3. And that is, you are finding yourself dissociating a lot in relationship to your body. What is dissociation? Dissociation is a psychological coping mechanism. It is a coping mechanism our mind employs when we're going through severe trauma. So that way we don't have to really be present when the trauma happens and isolate ourselves. That's when we have out of the body experience. Dissociation is defense that primarily happens during severe abuse, severe sexual abuse, any kind of severe trauma infliction. And when you spend a long time feeling completely disconnected with your gender assigned at birth, one can say there is also long-term enduring trauma, and as a result, people learn how to dissociate. The reason why people who are trans and struggle with dysphoria learn how to dissociate is because it is incredibly painful and challenging to navigate this world, to navigate this life in a vessel that you don't identify with, in a vessel that everybody out there genders in a way that nowhere even close resembles who you truly are. And for that reason, a lot of people choose to dissociate. I wouldn't say choose, it's not a voluntary response, but your mind starts dissociating as a way of protecting you. Again, dissociation is incredibly common among transgender community. It is a sign of defense. It's a coping mechanism. So if you're finding yourself dissociating a lot, especially this is going to happen a lot anytime you are um, nude. Maybe you're nude because you just took a shower and you're looking at yourself. Anytime you are intimate with anybody sexually, you may find yourself dissociating a lot because connecting to your body in that moment can be incredibly challenging. So that's a sign number 3. Now, the final 4 signs that forms this pattern, this quad, I would say, of 4 signs that I see a lot. That is an indicator, a good indicator that you might be trans or you might struggle with dysphoria, is you experiencing a lot of gender envy. I did a video on gender envy. I actually did a video also on dissociation. I think I did a video on pretty much everything under the sun. So make sure you look through the video library. Gender envy is when you're looking at other people and you envying their gender representation, you envying their gender identity. And one of the reasons why you envy it is because you see a resemblance of your inner desires. You see a mirroring back effect of your inner truth in another person. And that creates and breeds envy. Gender, one can say, is gender envy common among, for example, people with no dysphoria? I would say it's not so much gender per se envy. For example, I may look at another woman and find some aspects of her very beautiful and desires those aspects, but it's less, I would say, I'm envying her identity as a woman. I'm envying more certain characteristics. So there's the difference to that. Gender envy is very common. A lot of people struggle with that. Anytime you find yourself, and it can be also very subtle, by the way, anytime you find yourself out dining, having a lunch out with a friend, and you look over at somebody and suddenly you feel like everything inside of you just dropped. You feel this shallow effect inside of you. You look at them and you feel tremendous sadness and disappointment towards yourself. And you so badly want to be that gender identity. You so badly want to be just like that person, just like that girl or a woman or a man or anybody who might be even non-binary gender bending. You look at it and there's a strong, strong desire. You're almost jealous. You have this inclination to imagine yourself as that person. That's, my friends, gender envy. So these are the 4 most common signs that together kind of form a quad. One, again, is that you're spending a lot of time thinking about your gender. 2, you are spending a lot of time isolation, in secrecy, in your gender bending by feminizing or masculinizing it with clothes. 3, you are dissociating, you're finding yourself dissociating more and more from your body. And 4, you are experiencing gender envy. And it doesn't even have to be a person you see out there, while you're dining out. It could be somebody you see on a TV screen when you're watching a sitcom, for example, and experience gender envy. So those are the 4 most common signs. When I talk to a lot of my trans folks, um, chances are they hit all 4. And I know that a lot of you are going to comment below and saying that you hit all 4, or maybe 3 out of 4, but it's going to be around 4 out of 4 or 3 out of 4 type of a hit. And if you're still questioning your gender identity and you hit 4 out of 4, I would say that's a very strong indicator you are struggling with gender dysphoria or might be trans. And I would say that's an indicator for you to spend some more time looking into that, perhaps finding a therapist in your area and digging a little bit deeper in trying to understand your gender identity. Comment below, let me know what your thoughts are, and I will see you all next time. Bye.